Hello, and welcome to the HIV.gov's coverage of the 2024 National Ryan White Conference on HIV Care and Treatment here in Washington, D.C. I'm Lieutenant Commander Tanya Grandison, one of 3 executive co-leads for the 2024 conference and Senior Program Management Officer with HRSA's HIV/AIDS Bureau. Here I have today with me to have a conversation is Dr. Michael Kharfen, Director of the Division of Policy and Data for HRSA's HIV/AIDS program. And I have here today Kahlib Barton. He's the Chief Program Officer for the True Colors United and one of our conference day 2 plenary session speakers. So welcome to you both, gentlemen. Welcome.
Thank you.
All right, so Michael, I'm going to start with you. So on day 2 of the conference, the plenary is going to focus on empowering community. And so, which is a hot topic, actually. So how is that important to the Ryan White program?
Thank you for that question and the opportunity to talk about our day 2 plenary,
Yes.
Empowering Communities, which is part of our Ryan White HIV/AIDS program strategic priorities. Community empowerment, community engagement has always been, to me, the heart of the Ryan White HIV/AIDS program. When it started in 1990, 34 years ago, it was intended to have community as a major participant in the planning and implementation of Ryan White programs. The time, and I started working in HIV in 1985, before the Ryan White program, and I know what the difference was between what it was like prior to 1990 and post 1990. And what was most important about it is that it really did ensure the involvement and the respect and value people with lived experience and people with HIV. And as a person with HIV, to me, that is a core element.
Yes.
That is what is our fundamentals. And our discussion on tomorrow on Wednesday is bringing community members, bringing people with lived experience to share their insights into how we can continue to advance this core element of the Ryan White program.
Yeah, I love that. It has been 34 years, hasn't it? It's been 34 years. And so I love that good transition to speak with Kahlib about today's plenary session. Today's plenary session focuses on the perspective of and the importance of community engagement and those strategies for engaging people with lived experience. So in your work, how have you been able to engage people with lived experience, and how has that work been to support those folks?
That's a great question. I actually found this work by being engaged as a person with lived experience. I have the pleasure of working in both HIV and also housing work. Oh, awesome. And I also have lived experience of homelessness and housing instability. So it's been very important for me to be a person who's closest to the issue, who's been a part of creating solutions. And I've been in a unique position now that I've been on both sides of this to be able to continue to grow that effort of including people with lived experience. And I'll tell you, the difference is completely night and day. When you're creating solutions without people who are closest to the issue, you're not sure if they're going to be effective or if they're going to be sustainable solutions. But when you have people who are closest to the issue, who can speak directly to what their challenges were navigating systems, they'll be able to create solutions that are lasting and helpful.
Yeah, this is great. This is important work for our vision, for HRSA's vision for the 2030, right? So, Michael, I'm going to go ahead and switch it back to you because Kahlib said something as we're trying to achieve the Ryan White Program 2030 vision and the reaching of 200,000 people with HIV who are not in care. And so we know that it's important to engage people into care. And so how can our HIV community set up to meet this challenge?
Well, I can't think of a better program that is set up to accomplish this goal. The Ryan White program serves now about 570,000 people. We've made tremendous advances in the care of people with HIV to now achieve about a 90% viral suppression rate, as well as that in terms of retention and care. So when we're talking about people who are not consistently engaged in care, I think the Ryan White program is positioned perfectly
Yeah.
to be able to achieve this goal. And Dr. Cheever often says this phrase, which is, everybody who's not in the room, please raise your hand.
Oh, I love it. I love that.
And so that's what we need to focus on, and that's what we'll be talking about some tomorrow as well. And throughout the discussion of the Ryan White 2030 goal is, how do we get people into the room? How do we get the experience and the expertise of people with lived experience to help guide our programs? How do we transform our models of care to say that those 220,000 people who are not consistently engaged in care, that there is a home for them and an opportunity for them? And we know that in some cases, those individuals have people who have had experience with care before and it has not worked for them. So that means we as a program have to look at ourselves in ways to say, how do we rethink some of our work? How do we keep the people that we know have been consistently engaged in care, but then also reach in different directions and in different ways that can engage this group of people?
Perfect. I love it. I love it. Kayla, is there anything additional that you would like to add in terms of supporting our vision for Ryan White 2030 and engagement for people not in care?
Yeah, I think you definitely summed it up very well. I think that, in order for us to achieve radical change, we have to have radical and inclusive solutions. And that means that we have to be very mindful of who's not in the room. We have to be paying very close attention to that. We also have to see what our data tells us and what does it not tell us. What are we assessing and what are we not assessing? And what maybe while we're assessing, we're having challenges actually getting to the answers that we're trying to get to, because of maybe who's the person who's doing the screening, or maybe that person's needs aren't met. We just have to be mindful that that when we're approaching these challenges, that we have to approach them as whole person, whole people, and understand that this issue of HIV cannot be addressed in isolation.
I love that. Thank you both. So one quick question. What are you most looking forward to outside, of course, engaging of the community? What are you looking forward to with the conference over the next couple days?
Well, it's so exciting. It's a little bit overwhelming at times to be here all in person again. The last Ryan White conference in person, I was a participant on a plenary in 2018, and to have 3,000 people, don't get nervous, in the room at one time, but at the same time, the energy and the opportunity to network with people and to learn with people, because you learn in the sessions, but then you also learn in the hallways about what people's their experience, because you hear a question and you go, wait a second, that's something I've been interested in hearing about. And that comes from being in the same place together. And I know we do a lot of great work virtually on the screen, but being here, it's just exciting beyond real words to say.
Absolutely. And Caleb?
I'm honored, as I've been doing HIV work now for almost 10 years, and this is my first National Ryan White Conference. So I'm very honored and excited to be here and be speaking at the plenary tomorrow. I'm just excited to make connections and to learn.
Well, I want to thank you both, Dr. Kharfen, Michael Kharfen, Caleb. Thank you both. It's been very exciting to actually interview you both today, and we're looking forward to carrying out this vision and engagement, particularly with Ryan White 2030. So thank you.
Thank you so much.